As COVID-19 cases are rising once again, at-home COVID tests are out of stock at many pharmacies across the nation. But how effective are at-home tests anyway? BNC medical correspondent Dr. Corey Hébert and correspondent Stephanie Bertini weigh in.
At-home COVID tests out of stock at many pharmacies across the nation as COVID-19 cases are rising once again. Over the holidays, health experts recommended people get tested before gathering, and it seems all those tests have created a stock backlog. But how effective are at-home tests anyway? We asked BNC medical correspondent Dr. Corey Hébert to weigh in.
The at-home test is never going to be as accurate as the PCR test. PCR stands for polymerase chain reaction, and basically what that does, it looks for a very specific part of the COVID-19 antibody in you, and that is what makes it so accurate. So the test that you do at home, it's never going to be as accurate.
Some advice on how to treat those tests?
Now, I want you to think about the at-home test kind of like a pregnancy test, meaning if it's positive, it's positive. But if it's negative, you may not have enough pregnancy stuff to make that test positive yet. So a lot of people have had negative pregnancy tests and they take another one a couple of weeks later and it's positive. So I want you to think about it like that. If it's positive, you can go with it. If it's negative, not so sure. You have to be a little bit more careful.
Maybe there isn't enough of the virus present, so to speak, in layman's terms, for it to render a positive.
The Centers for Disease Control and Prevention says one should repeat a negative at-home test within a few hours, at least 24 hours apart. But by then, you might as well just go to a testing center.
Screening tests are just that, screening tests. So you're going to get a lot of people that are they're going to want to use them, and they do have their place. However, the testing where you go to the facility for a PCR is the most accurate.
Screening tests can be turned around quickly and maybe offer some peace of mind. But again, not a definitive answer. Also, again, you might not even be able to find them.
You probably won't be able to find these at-home rapid tests anymore because they're selling out all over the United States. And where you'll be able to find them, they're very expensive. And so should you use them as a screening tool if you can actually get them? You know, let's just say you're having some people over to your house. You can screen them to see if they are positive. And if they are, if the test is positive, then you can actually go with that. If the test is negative, however, it doesn't really mean that that person is negative 100%.
I'm Stephanie Bertini for BNC.